We will get this April County Health Committee meeting underway. First, we need a motion to approve the minutes of March 24th. Could I get a motion, please? Member Daly in a second. Member Williams. Any corrections? All right, please vote.
I'll do it by voice vote of aye.
Okay, thank you. Okay. Okay, that's unanimous. Thank you. We'll jump right into the informational items. And first we have the Board of Health monthly update. Hello, Monica.
Thank you. In your packet, you have our March Board of Health minutes. Our board met again just last Monday as well, during which they did approve a recommendation for the Chapter 10 food safety ordinance that will be before you later on in the agenda. Additionally, at our board meeting, we continue to recognize staff through our mission moments, as well as starting our preparations for our grant budget years, which again, a majority of our funding is a July 1st date. So we're working through the state and getting our award notices for all of our grants right now. I'm more than happy to answer any questions.
Thank you. Does anybody have any questions for Monica? All right. Oh, Member Ricker.
On food trucks, the state of Illinois has got a bill, I think that's sitting out there potentially to have a state level approval for food truck licenses. I'm not sure where that's going, but one of your staff and I had a really good discussion the other day about would it make sense to do a tri-county agreement with Tazewell, Woodford, and us to help our local food truck vendors to have, say, a license that we'd all three agree on that would allow them to cross the river and be flexible. So I just want to throw that out. Not that you have to have an answer, but I wanted to bring it up as an ask.
No, more than happy to take that feedback back. The food truck freedom has been on our radar for a couple of cycles now with the state. The challenge, of course, with any type of legislation is that it removes local authority for ordinances and for oversight. The food program is a very complex program. There are general basic level, also a level of licensing that's required in terms of the staff to do inspections and the oversight. It is, I will say, every local health department in Illinois does meet the state requirements. Some counties, including Peoria, do much more and beyond. That's why we are kind of a premier program and why some of our staff sit on these different committees at the state level. And so there are those kind of challenges. I think something that's more regional is much more of a realistic approach than a statewide one.
And I'll just comment, I mean, we're obviously coming into summer season where food trucks are more popular, and I know I've asked our facilities people when the plaza will open so people can come out and enjoy their lunch times and food trucks can come along and provide them food. So timing is good.
Any other questions? Okay, thank you. Next, care and treatment. Nobody from care and treatment? Okay. Emergency management. Good afternoon, Jason.
Good afternoon. So I've got my monthly report in front of you. A couple of things I wanted to highlight rather than just let several meetings I've been able to share that we're kind of back to things as usual, but on the meeting attendance wise, I particularly want to note that we really are playing, emergency management, meaning information a mile wide, but only an inch deep. Because if you look through all those different activities, it's everything from hazardous materials stuff to public health related stuff, homeless work group, which is great. So we're doing, really engaging with our community partners on all sorts of levels, which we're trying to do with respect to our program. On the backside, specific on the training side, I wanted to highlight myself, as well as our emergency preparedness planner and a member of our WIC staff, one of our breastfeeding peer counselors, participated in the NATO Public Health Preparedness Summit in Baltimore a couple weeks ago. Particularly wanted to highlight the fact that as an agency, our planner worked together with our WIC program to develop an emergency breastfeeding plan for in the event we needed to assist mothers, either that be with human milk or whether or not it be for formulas or other things during a shortage or during a disaster. And as a part of that work, they were able to highlight at a poster session. So that was something we were pretty proud of out there. That pretty unique thing that we're being able to do as a community, and a lot of people stop by to talk to them about that simply because it's an area that many communities hadn't really considered. So on the outreach side, or I guess we'll go to the equipment, we continue to look at our outdoor warning siren system, particularly right now we're in severe weather season. I was going to highlight, this has been a extremely busy several weeks for us. In fact, this year we've activated our spotters on 5 separate occasions, and some of those times they've been activated for upwards of 3 hours if they've been out in the community monitoring weather for us. So they're an important part of our team, and I want to highlight that. Along with it is the equipment. Again, our outdoor warning siren system. You'll see that there are several sirens. We continue to repair them as those we identify the need for that. Speakers seems to be the biggest issue. I know that not on this list. There are 2 sirens out there that have speakers out. They're back ordered, so as soon as those are in, our vendor typically gets those taken care of. Along with our outdoor warning siren system, we've been looking at some upgrades to it, and particularly this year, wanted to take the opportunity to do like public outreach campaigns. So I've initiated that. You may or may not have seen some emails or heard of that, but I've got at least 5 separate town halls, if that's what you want to call it, scheduled throughout the community, from Brimfield Library, partnering with Bartonville and Limestone Fire, Logan Trevoli Fire at Lake Camelot, in Peoria Heights and West Peoria to date. Those are just the 5 we've got scheduled. Our plan is to be out in the community, have people, we're calling our presentation Sound Matters, Understanding Your Outdoor Warning Siren Network. Our real goal is that people understand that that network is just one of a number of tools for them to use as the public to identify and be alerted when emergencies happen. Hopefully answer some questions as they come up. And then we're doing some significant event planning. Obviously, I was sitting back in my chair and I saw the America 250, and it reminded me we will have our initial planning for our Red, White, and Boom coming up here, I think, the next week or so at the fire department. In addition to that, Scott has connected me with the Catholic Diocese of Peoria, and as a part of their celebrations for Bishop Fulton Sheen's beatification this fall, we're going to be hosting a number of events in the community, and so we've got a meeting scheduled with the diocese and a number of our first responding agencies, the hospitals and things, just to ensure that as we open our community to members from really around the world, that we're prepared should something happen. And we just talked about some of the various things. We're hoping to learn maybe what some of our fellow communities across the United States are doing with FIFA World Cup this summer. And although our events may not be as large as those, we'll be seeing similar type of demographics potentially as individuals from around the globe are expected to participate. So. And finally, one other thing I just wanted to address or talk about is that we've been working quite a bit with the hazardous materials team with, is that an area that we're doing a lot more planning with is on solar or renewable energy. One of the issues we ran across, I just saw Captain Pomeroy last week, and we're beginning to see a handful of things come up with those things. I just want to make sure that the committee was aware we were working on, how we can ensure on the emergency management side and the public safety side that as renewable energies become more and more common, how we can ensure that we're doing that in a safe manner. And a couple of the issues we've ran across is a big issue we run across is ownership changes. The sign is never correct on who owns the property. If you talk to the fire department, every time they've been out, they call and they have to call 3 or 4 different people. So we continue to work with facilities on those, ensuring that contact information is critical. We've had at least 3 facilities where we've had solar panels in severe weather, or at least in winds, that have been dislodged and have been damaged due to the wind. And so we've been fortunate locally that we haven't suffered a tornado, or at least a number of tornadoes that some of our communities next to us have. But that concerns us, that if one of these fields happens to be in a location where we do see that type of significant weather, what that may look like. We had our first hazardous materials report at one of those facilities a week ago. We had a transformer leaking oil. And so the hazmat team was able to go out and take a look at that and get an idea, because we just didn't even, it's a brand new facility and the turbines already went bad. And so we're looking at what type of continuing to work with facilities on what we can do. Particularly the solar facilities have seemed to have been, they popped up quite a bit. And so they've kept us pretty busy trying to keep up with those particular things. So other than that, things are going great in the world of emergency management. I would say funding wise, we have received applications on our public health side for both our public health preparedness grant and our city's readiness initiative grant. So we're pleased to say that we're going to be at least funded at a stable level on the public health side. We continue to have funding problems on the emergency management side with FEMA and the Department of Homeland Security and everything that comes with that. So,
Thank you. Member Elsasser.
Did you say that on one of the solar fields you had a transmission leak? Or
we had a transformer
leak?
Leaking oil. That's correct. Yeah.
Okay, so the people that own the provider that owns that, wouldn't they have found that out before you so they could go ahead and fix it? I mean, I'm glad. I'm glad you're on top of that, but I just.
Yes, no, that's correct. So how we were notified of that is that we received a report. We received a hazardous incident report from IEMA after it was reported to them. We were notified within probably less than 24 hours.
Okay.
Yeah.
Any other questions? Yes, Member Duncan.
Yeah, Jason, would you talk a little bit about, say, when you have equipment that is down, such as your sirens, what your identification, your alarm system for even that alert for that, if I'm explaining it correctly?
Sure. So the outdoor warning siren network, on top of the audible exercise or drill that we hear the first Tuesday of every month at 10 o'clock in the morning, the sirens do an inaudible drill every evening at night, in the middle of the night. So they actually go off. To my understanding, they send a tone out that's inaudible. We can't hear it. Animals can't hear it. It's above my pay grade to understand radio waves. But so each morning we get a note that'll identify if the siren worked or not. And when it hasn't, then typically what we do is we work with the vendor and we try to diagnose the problem. Sometimes we can diagnose the problem by just running another test. Oftentimes, the first thing we do is we run another test and things are fine, because it's not uncommon for a siren to report back in the morning that it's not functioning. And it's a transmission issue. There's 80 plus sirens trying to send a message in at the same time, and some get their message through and some don't. So that's primarily. Speakers seem to be the biggest issue. Everything else they can repair pretty much right away and put a loaner in, but the speakers are on back order, and that's a equipment issue.
Yes, Member Ricker.
Maybe if you can make some comments that, I think I've seen a report where you talked about, FEMA has made a conscious choice to move some of the decision-making control to local authorities, and just maybe give us a little flavor of pros and cons, how that's working within your organization to have some of the control here.
Well, I think it's more an issue of what the executive order and what they're looking to do is not so much just the decision making, but the funding is the biggest issue. Decision making, to be quite honest with you, I mean, I've always felt like at a local level. Now, we've never been in a situation other than COVID where we've had to have the federal government come in and be actively engaged with anything we do. The funding we get through our EMPG grant is pass-through money through the state. Maintaining the grant deliverables, if and when we have a grant, and the accreditation with IEMA is fairly simple. I think the big takeaway that most myself and many of my colleagues look at with the federal government and their stance on emergency management is that they're really going to push not just decision making, but the decision making on the funding often to the local and state levels as to with regards to things. What for us for Illinois, I mean, there'll be much more mutual aid wise as a state. We're good community wise. I think as a state, we're looking at more on how we can be more palatable as a partner with some of our neighboring states and doing state to state through EMAC compact and some of those different areas. But I know that they're looking to minimize like the strategic national stockpile and really rely on states to stockpile issues and things of that nature.
Member Allison.
This is more food for thought, and if the chair would support it, could we look into possibly doing something through planning and zoning with an ordinance about requiring updated contact information on solar fields for the sake of emergency planning or our fire departments?
And we work just so we're open. I mean, we work with Andrew. We talk with planning and zoning, and he's actively engaged with. In fact, I think he just made some revisions, if I'm not mistaken, to a wind ordinance. I don't want to say necessarily the request of us, but after consultation with primarily our hazardous materials experts. They're the ones that lead this, and really from that public safety side. But yeah, we work really well with planning and zoning. So I want to be sure that we communicate that, and he struggles with the same things we do. So I think the assistance is appreciated.
It's a good thought. Thank you. Any other questions? All right. Thank you.
Great day.
You too. All right. Next we have Regional Office of Education. Sorry, Becca. Hello, George.
Okay, so in front of you with the update, I always try when there's a safety-related incident that goes on in the county. So the bomb threat from about 3 weeks ago now, just to give you sort of an update on all the things that are going on, school safety in particular in the county with our office specifically. But I also think it's important that we look at how our office is expanding to a degree into some other areas and other parts of Peoria County government. And so when you look at the list, just a few highlights because I don't want to read the whole thing. And I'll get back to the most exciting thing, the spring celebration here in a minute. Obviously, we're working with Amy Chenal, who's running the Domestic Violence Fatality Review team. And if you're not familiar with that particular committee and what we're doing, is we are reviewing a domestic violence situation that resulted in a fatality. Has to be adjudicated through the court systems. Everything has to play out as far as legally. We take a look at the information, all of the circumstances leading up to it, and then we find the red flags, and we find all the instances where maybe a service organization could have intervened, which might have saved that life. And so we have to do 2 a year as part of our commitment. We've been meeting probably for 3 or 4 months. We anticipate we'll have our first case study done this week, and then we'll pick up a second one. And the reason that you might be saying, why is the ROE on that committee? It's because domestic violence also extends parent to child. And so they want to make sure that they have a representation from K-12, which is not only me, but also Tony Chenal, who's the superintendent out of Princeville. And so that's one example of what we're doing also sort of outside of our normal everyday mandates that we have in the county to work in other organizations. We're also working with, I know Jason said he would stay here for a minute, but with emergency management, in particular with reunification, if we have to do a family reunification because we have a mass casualty event that isn't school related. And so we've been working with them on using a school-based system to try and reunify other families. And of course, I think you're probably all aware of the work that we're doing at the Health and Human Services building. The stuff we're doing for schools, I've mentioned a number of times. With one specifically, the Illinois Fire Service Institute will be in next Friday at our regional reunification site. They're going to do a brief overview in the morning, and then we're going to run a exercise in the afternoon so they can see our plan. They have sort of eyes on our plan to provide us feedback. so that then we can make any adjustments we need so that we're as effective as possible in the event that we have to actually use a reunification plan, which we hope we never do. We hope there's never an incident where kids and families can't go to the building where their students are housed. There's some stuff in there as far as statewide. I won't bore you with all of it. We'll get to the exciting stuff, which is the arts and education spring celebration started last week. And if you'll remember, we had just over 4,000 students participate in that last year. We have a number of new districts, new schools that are also joining us. So we hope that number goes up a little bit. The great thing about being at the riverfront in the Cat Visitor Center is that when it comes to rain, it's a 15-minute transition where they move chairs, everything indoors. Both of them have spaces that can take up to 3 performances. And I believe that was the issue yesterday because we had some, inclement weather. And so typically a very quick transition there. And that's GMB. And then finally, I know we've talked about this Alternating Learning Opportunities program. I think what is really important, and I have to explain this a lot to folks, and I want to say it one more time so everybody understands. We have no authority. So our office has zero authority. We can't make anybody do anything. And I like leading with that. We're highly successful in the county with our school districts because we build really solid relationships. And so sometimes we ask them to do some things that they don't like to do, or maybe they're not really sure about, but because they know that we always have their best interests in mind, it's never a problem. And so this ALOP program is something that we ask them to take on, which is great for our office. It's great for services for kids, and it's great for districts. And so sometimes when you do that, you have a conversation internally. I hope it works out like it's supposed to. I hope it goes well. There's a lot of hope in the beginning. And here's what I will tell you. We had a meeting with them, and I just made a brief comment about the ALOPs, and every school that was there at that meeting immediately said, things are going well. We wouldn't have thought in 6 weeks that things would be so good, not only for those students, but for the things that are going on in our buildings. And so we've talked about it here. I want to sort of give you an update. And we would anticipate 2 more schools coming on. Currently, we can't serve K-3 students legally. That, I think, was going to change last year and didn't, but we also think now it will change this year. It's been tied to another piece of legislation that they want to get through. That's how it works. And if that's the case, we would anticipate we'll pick up 2 or 3 additional. So we'll pick up somewhere around maybe 4 or 5 next year. So that's just a brief, not so brief update on the ROE.
Fantastic. Thank you. Yes, Member Elsasser.
My hearing is not the best, but did you say something about Superintendent Tony out there at Princeville, or did I?
I did. So Tony is part of the domestic violence fatality review team, helping represent in case there's a case that we might take up with the death of the child.
Okay, thank you.
Mm-hmm.
Any other questions? All right, thank you.
Thanks.
All right. Now we're ready for sustainability.
Good afternoon. I just have a few highlights, but a couple updates as well of things that have maybe just a little more information since the agenda briefs were due. Batteries is an ongoing program. We're working with partners to be able to have battery boxes at more locations. There's a couple of libraries that are interested. The courthouse, Health and Human Services have battery drop-off, and then 12 fire stations. We're going to continue to work with fire stations as a safe place. Jason would support that in terms of having batteries at those locations where everyone is required to be trained to have the battery boxes, but that is free. Just expanding a number of drop-offs available to residents, in addition to those places like Lowe's, Home Depot, Target, where those batteries can be dropped off year-round. There's been movement on the household hazardous waste collections that will be facilitated by GFL. They will be at the same time or similar time that they were last year, August, September, and October. 2 of those locations have been identified, Three Sisters Park on September 12th and Alpha Park on October 10th. We are looking still for a location in Peoria with an August 8th date. As soon as that is confirmed, I will for sure push that out to everyone. Electronics collection, we did have our first collection this past Saturday at West Peoria. It was beautiful weather. And that can mean a lot of people show up. It also can mean that not a lot of people show up. So we don't have the numbers yet, but I don't expect them to be as high as we would have liked them to have been from that West Peoria collection. Community cleanup. There have been some properties that have been identified that continue to be a little bit of an issue with garbage piling up and some increased litter. So there is always a collection year-round that's sponsored by the Sustainability Department in partnership with Limestone Township in October to do a cleanup event for those who maybe don't have transportation. And people show up with wheelbarrows and trailers of trash. And it's held at the Eagles Club. We are doing a mid-year collection as well on the 16th. So we have postcards, we have flyers. Planning and Zoning is helping to support that as well. And those postcards will go out soon to folks who are in that area. But Planning and Zoning is also mailing some flyers to any nuisance property in the county so that they also can participate. Moving forward to the brief section under Education and Community, with it being Earth Month, we were hopping a bit. We also participated in a couple community events: Clean Water Celebration, Forest Park Nature Centers, Earth Day events, which I did not include in the brief and wanted to mention quickly. We do have a few community cleanup grants, as mentioned before, that are working. We have our first quarterly report from Bartonville Parks, and they've done a couple collections around the area. And so I look forward to sharing more with that next month. Also wanted to mention that Compost Week is May 3rd through the 9th. We're doing the same program we did last year, which is free compost giveaway. OSF Garden of Hope is our partner in that. So the compost gets dumped there, and we will push out information for residents to be able to go there and get a couple buckets of free compost. Those people who utilized it last year absolutely loved it, as you would, because it definitely helps the garden grow. And we're also doing a giveaway for the food scrap kiosks. Last year we did 5 subscription giveaways. So we're doing that again. So you'll see that on social media very soon. Skipping down to Recycle Coach, that is still going pretty well. I know we pushed it very heavily on social media. Seems to be helping in that the interactions were up considerably over last month with 5,372 this month, with 3,126 the previous month. I think the last thing I want to talk about is the energy plan. So the very last page of the sustainability update, we do not quite have that dashboard live, but we do have a beta version we're still continuing to work on. With GIS losing a staff member, it's slowed it down a little bit, but we hope to have that to you soon. It is coming. And then also the health department had a community garden, this Thursday. Woodruff students are showing up, building some elevated beds for us. So to meet ADA compliance, make it a little bit easier if people have mobility issues to be able to also participate in that community garden, and then helping us put 12 raised beds in place. So that's happening Thursday. So that's the first phase of that garden coming back, and we're really excited about that. And that's all I have, unless there are questions.
Thank you. Yes, Member Allison.
With the battery box drop-offs, I understand how they work, and I think that's great. But assuming most of the public is used to throwing their batteries in their garbage, how do we get everybody retrained to look for those boxes?
We need to do some education. Yeah. So we'll continue to do some education on that for sure. I made the request. Tim and Rachel from my department, Tim Shelley, meet monthly on what is moving forward, what we're trying to push, and make sure they're hitting the right targets. And that was one thing that we discussed. We need to make sure we're covering paint and battery EPR.
if I could make a suggestion of
Yes.
getting into the schools, because the
Uh-huh.
kids can really nag their parents.
Absolutely.
I know that firsthand.
Any other questions? We didn't go over landfill, but member Williams and I have invited somebody from GFL to be here next month to give us more in-depth status on where we are with the transfer station, with the landfill. We're 10 years out for landfill 3 being open and functional, so it's something that I want to stay on top of to make sure that the committee is aware of what's going on. So, yes.
We do have the communication plan has been addressed between GFL and the county. We have a mock-up flyer that we handed out at the current freeload drop-off locations very soon, hopefully by next week, so that people know that it's coming. We just don't have a date.
Sure.
We'd really like to have a date, but we don't have that date yet. But to know that there will be a shift coming soon.
Hopefully by next month we'll have all that information. So, thank you. All right, next we have the Center for Prevention of Abuse on a long-term ombudsman update. How are you, Kevin? John?
Yes, sir.
Why
my
did I
name
think
is
you were
John.
Kevin? I'm sorry, my apologies.
Oh, it's all good. I always look forward to coming, letting you know what's happened over the last quarter with our cooperative agreement. You should have a copy of the metrics from the last quarter, January through March, as part of your packet. I want to spend the time I have just giving you some very practical ways that we've been able to help some of these residents. Ombudsman Department covers all kinds of needs, all kinds of complaints. If you can think of something to complain about in a nursing home or assisted living center, well, we take care of that. I brought along 2 of my staff members with me this afternoon, and I have, of course, 1 dedicated staff member that all she does is Peoria County. But all of the rest of my staff also have at least 1, some of them 2 or 3 facilities that they visit within the county as well. And some of these things may seem like a little thing, but to a resident that's in a small room that doesn't have a visitor for Lord knows how long, small things are big things. And give you a few examples. Our ombudsman was attending a resident council in a nursing home. A residence council is when the residents attend a meeting without the staff members and they can complain about anything. And we learn a lot during those resident council meetings. And this resident had no spending money. Up until last year, residents were allowed to keep $30 toward their personal needs. Due to successful advocacy from ombudsmen all over the state, we now can report they're getting $60 a month to be able to keep. But that goes toward all of their expenses. If they receive any amount of public aid, all of their pension, all of their Social Security, all of their Medicaid, all of the Medicare, everything goes toward their nursing home bills. They're allowed to keep $60. And this resident was not able to keep any. And our ombudsman got permission to advocate, and it turns out this resident had not, the facility had not allowed him, had not helped him to apply for Medicaid. Our people got on that, and lo and behold, this resident's Medicaid was approved, and now it gets that $60 personal allowance. And that's a big deal. When you can buy a soda pop or you can buy whatever you want to buy, that's a huge morale booster. We had a resident in a supportive living center that had a broken scooter. I don't know if any of you have mobility issues, but that's a big deal in nursing homes. I have multiple sclerosis, and That's why it doesn't look very pretty when I get up and down and come to give my testimony. This person was in a facility that refused to help pay for repairs. And our people got involved, and sure enough, they were able to speak on the resident's behalf. This resident had limited speaking ability due to a stroke, and at no expense to the resident and no expense to the facility either, repairman came and fixed the scooter under warranty. It's a shame we had to get involved, but sometimes that's all it takes. We have a resident who stated his call lights were not being answered, and he often had an accident without going into a lot of graphic details, and then the staff would yell at him for being a bother. This resident never had a care plan meeting. When you or your loved ones go into a nursing home, they're entitled to have a care plan meeting within 48 hours of being admitted, again within 30 days, and again every 90 days. We still have facilities that say it's too dangerous because of COVID. It's ridiculous. Our ombudsman successfully advocated and got this resident a care plan meeting, and his complaints were addressed. We were able to get him physical therapy, and guess what? The facility was over medicating him with narcotic drugs, and it was causing him to have behaviors. The behaviors were addressed. This guy was much better, and he was able to go home within 3 months, all because of the advocacy of our people. I'll give you just a couple more. We had a resident that was in a nursing home and was being complained of neglect. Staff members were not changing ostomy bags, and the resident wanted to move to a private home in the community, but once again, the facility stated that was not going to be able to happen because it wasn't going to be safe. Our people got involved, and we found out a CNA was deliberately keeping this resident from receiving services. That CNA was removed, and the resident received training on how to properly take care of his physical needs. And guess what? He was able to move to a private home. And last, we had a resident in a nursing home who had not had a conversation with her mother. Her mother lives in an assisted living in one of the northern counties. She'd not talked to her mother on the phone since 2023. With the permission of the resident, our employee coordinated with another ombudsman in northern Illinois to set up a FaceTime call between these two women on a smartphone. Now, wouldn't you think that someone at the facility could have coordinated that? But that's where we come in. And because of our agreement, we have a dedicated ombudsman who's able to do more of these things. And she was able to talk to her mother for the first time in almost 2.5 years. And on top of that, we have an agreement where they're going to be able to talk to each other at least twice a month. That's the kind of work that we do. Some of it's not earth-shattering, some of it is. The abuse, the neglect. But these other things are quality of life, the things that make us different from animals. We're people. And these clients of ours, they have a much better life because of what these folks do. Thank you. I don't know if any of you had any questions.
Does anybody have any questions? Would you like to introduce your associates?
Yes. This is Willie McAfee, and Willie has been with our program for a little over 6 years. And then this is Jillian Beers. Jillian is a brand new hire. She's worked for the center. We've lost 2 employees over this last month. We had one gentleman who retired. He had to take early retirement because his dad went into a home, and Jillian is replacing that ombudsman. We have another one whose last day is this coming Thursday, so we may be introducing some more new people down the road. Thanks for coming.
Yeah, thank you for coming. Welcome. And thank you, John. Appreciate it. Not Kevin. John. Okay, next we have a proposed resolution to the Chapter 10 Food Safety Ordinance of Peoria County Code. Could I get a motion to put this on the floor, please? Member Duncan, and a second by Member Coates. Okay. And I believe we have Member Blair.
I would like to propose an amendment. You will have gotten a handout. If you did not, it should be floating around. You can make sure this is on page 39 in your packet, section 1012, letter A in that first paragraph in the red. We are adding we would like to add for a period of 3 years, provided the Board of Health conducts a third party fee study when required by statute. Since it is our job as the county board to set fees, we just want to make sure that we are not preventing a future board from having that option for that responsibility.
Okay, so this will force a board in 3 years to just review the policy and to see if it's the direction they still want to go. So, pardon me?
I believe you need a second for the.
Oh, yeah. Before, I was just going to have him give information to see if there's anything else, but do I need to then go on? If we change it. Okay, so I'll get a second on that motion. Okay, Member Allison. Okay, we'll go ahead and go through the rest of the information on this, and then we can vote. Here.
Your comments and your feedback at our last meeting with the health committee when we presented on not only what the changes were, but also the importance of why the fee schedule matters for us, just the overall cost that we're seeing as a health department and our continued flatline funding from grants. Primarily, as in the agenda briefing, much of these changes are focused on minor edits to some of our definitions, as well as adding language to help support food insecurity policies and practices. So really looking at our charitable food organizations. We've also seen changes around commissary and shared kitchens. Our previous ordinance, they were one and the same, but with new FDA codes, we're seeing commissary be more of a requirement. Shared is where a community kind of comes together to put into a space. So really 2 distinct purposes, and we wanted to make sure our language was very clear about that as well. And then lastly, there was language related to the issuance and renewal of our licenses. This helps us with some of our operational aspects. If you're not familiar, our health department issues annual licenses in the October time period. And so, again, this helps us with just the reopening process of the establishment, making sure that they're meeting the current standards. And then lastly was language related to, of course, the fee delegation. As I mentioned, the Board of Health did meet on the 20th of April, where they did approve the recommendation of what you see in the packet as proposed language. More than happy to answer any questions.
Does anybody have any questions? Yes, Member Fan.
Just out of curiosity, in our financial policy, what is the frequency of our fee study?
The county board's financial policies say that fees should be looked at on a 2-year basis, and where applicable, a third-party fee study, when required by statute, should be done.
I guess my comment to that is if we're performing an outside third-party study, wouldn't it have made sense to make the health departments match ours so we could do that all at the same time? It just seems like if they perform their own third-party study, they might pay a higher cost rather than bundling it in with our fee study.
Great question, Mr. Phelan. Well, that's what's in the board's policies. For the last decade or so, it hasn't always been the practice, and the fees that are actually in this action item here come out of the fee study that was done in late last year or mid-year last year. We don't always necessarily budget for that third party every other year. So I think some of the fees are subject to in this action item, we're subject to a fee study, but not all of them. So it does give the Board of Health some flexibility for those where there is not a fee study required. But that being said, there is some logic behind your question, absolutely.
Just a quick follow-up. If the Board of Health did decide they wanted to perform a fee study at the same time we conducted one, is it right to assume that they could participate?
That would be my perception, yes.
Thank you.
Any other questions? Yes, Member Elsa's.
Were any food vendors or restaurant people involved in your committee?
Yes. So for all three of our ordinances that are environmental health based that are also within the county code, we have work groups around that. So we do have a food safety work group. It's made up actually of a full spectrum of our food establishments. So everything from private restaurant that is non-franchise to a franchise-based type of restaurant. Think of your fast food chains, as well as nonprofit locations, so churches, food pantries, as well as long-term care in schools. So we actually try to get the full range of risk category as well as types of establishments. So all those members were actually a part of the review, and they acknowledged that only the language changes they were positive of the definition changes and the clarity that it brought forward, but they also recognize the reasoning behind the fee study as well.
Okay, thank you.
I guess just curious, back to the fee study, and I guess on Member Phelan's question, is the large scale fee study that we just had done, did the Board of Health cover any of that cost?
I don't believe so. I think we budgeted for that in the general county budget, or maybe even in the finance departmental budget, but again, a general fund department, where we looked at fees from across the organization and multiple funds, just not the general fund.
So if it should be separated out on the next go around, then that potentially could go.
Finance can absolutely kind of work through the accounting of that on the back end.
I don't really one or the other, but I'm just curious as to how that would work. Okay, so just for my simplification of it, so we're removing the fees from the ordinance, and we're giving the responsibility of setting the fees to the Board of Health for the period of 3 years, and then it will be readdressed after 3 years. Does that boil down to? Okay. All right. So first we need to vote on the amendment to the resolution, which is putting the date in and saying that there'll be a fee study done. So please vote on the amendment. Okay. And then now we will vote on the resolution as amended. And that passed unanimously. Thank you. Next we have public comment. I don't see anybody here. Anything from miscellaneous? Okay, we're adjourned. Thank you.